Using too many common medications for headaches can seriously hurt your liver, even causing death. The liver, essential for survival, cleanses blood, helps digestion, and boosts energy. Unfortunately, some medications can directly harm this powerhouse, leading to what's called drug-induced liver injury. As you take medications or supplements, your liver quietly filters substances. This constant work raises the risk of facing harmful agents. Let's keep it safe, understand warning signs, and be aware of medications that could be harmful to it. Because a healthy liver means a healthier you. Number 1. Amoxicillin Clavulanate. Also known as clavulin, Amoxicillin Clavulanate is a medicine that fights bacterial infections like pneumonia or urinary tract infections. Ever used it? Share in the comments. Surprisingly, this medicine is one of the top ones, after paracetamol, linked to liver issues. It's a combo of an antibiotic and something that helps the antibiotic work better. Liver problems might happen due to an allergic reaction, although the exact mechanism is not entirely clear. Other medications like isoniazid, trimethoprim/sulfamethoxazole, erythromycin, itrofurantoin, minocycline, and the antifungal ketoconazole also have potential liver concerns. Number 2. Tylenol. Tylenol, a common pain reliever, is generally okay for your liver if you use it occasionally and stick to the recommended doses. But if you get a lot or use it all the time, it can harm your liver, leading to something serious called Tylenol overdose, a real emergency. If you think you took too much, call a poison control center or head to the emergency room right away. Using Tylenol a lot, especially for a long time, increases the chance of liver damage. This risk is higher for people with ongoing health issues, those who drink a lot, or those with existing liver problems. To stay safe, stick to the recommended dose, not more than 4,000 milligrams a day. Don't drink alcohol when you're taking Tylenol, and check if other meds you use, even ones you can buy without a prescription, also have Tylenol. Some cold or flu medicines, sneak it in. If you are finding this video helpful, please consider subscribing to this channel for more amazing health videos. Acetaminophen, Tylenol's active ingredient, can potentially harm your liver. When it breaks down in your body, it leaves behind something that can pile up and mess with your liver, causing trouble. This might lead to what they call drug-induced hepatitis, your liver getting inflamed because of certain meds, especially if you're not using them the right way. Imagine your liver as a guard for the drugs you take. After they do their job, the liver makes sure they leave your body through pee or poop, so they can't cause trouble. But sometimes, in this process, the liver accidentally makes something toxic. It's kind of strange that the pills we trust for our health might bring along some risks, right? Understanding how this all works helps us use our daily pills in a smart way, so be careful with what you're taking. Number 3. Diclofenac. Diclofenac, also known as Cataflam, is a pain relief medication commonly used for conditions like arthritis. The concern arises more when taken by mouth rather than applied as gels or patches. Applying it on the skin carries a lower risk of liver issues because the body absorbs less compared to taking it orally. The real worry comes with using it daily, especially for people with possible liver problems. Using it for a long time might increase the chance of serious liver issues. Non-steroidal anti-inflammatory drugs, NSAIDs, which include diclofenac, are often used for pain, inflammation, and fever. Some you can get without a prescription, but oral diclofenac needs one. Diclofenac is singled out among NSAIDs because it might harm the liver. Sometimes, this harm might show up in liver function tests, LFTs, even if you don't feel any symptoms. LFTs check liver enzyme levels, and high levels can mean a problem. Healthcare pros do these tests with a bit of your blood. Even though severe liver issues from diclofenac aren't common, the risk goes up if women take higher doses for a long time, usually more than 4 weeks. It's important to be careful with how much and for how long you use diclofenac, especially if you might have liver issues. Number 4. Amiodarone. Amiodarone, a medication aimed at regulating irregular heartbeats, comes with a noteworthy consideration for those using it. Prolonged use of amiodarone may lead to increased liver function tests, LFTs, in about half of the individuals on this treatment. Although this elevation is typically not associated with severe health problems, approximately 1% of users could face more significant liver damage. To highlight this potential risk, the FDA has issued a boxed warning, their highest alert level, to inform both patients and healthcare providers about the substantial threat amiodarone poses to liver health. For those relying on amiodarone, it becomes crucial to undergo regular monitoring of liver function. Any emerging concerns or symptoms should be promptly discussed with healthcare providers. Liver injury linked to amiodarone tends to be more prevalent in individuals taking higher doses over extended periods. Fortunately, this risk is manageable through vigilant monitoring. Regular liver function tests are typically integrated into the routine while on amiodarone, ensuring that the treatment remains effective without causing harm. The key takeaway for individuals using amiodarone is the necessity for ongoing communication with healthcare providers and consistent checkups to assess liver function. This monitoring approach aids in the early detection of potential issues, allowing adjustments to the treatment plan if needed. By adopting this proactive stance, individuals can maximize the benefits of amiodarone in regulating irregular heartbeats, while minimizing the potential risks to liver health. If you've watched until here, drop a comment sharing your thoughts about these liver-damaging drugs. Let us know if you've watched the video till here. Number 5. Statins. Statins, including well-known types such as simvastatin, atorvastatin, Lipitor, and rosuvastatin, are commonly prescribed worldwide for managing high cholesterol effectively. Despite their benefits, these medications carry a potential risk of liver injury. The exact way statins might cause liver damage isn't completely clear, but it's believed they could generate a harmful substance or trigger an allergic reaction in the body. Another statin, Zocor, simvastatin, has also been associated with a possible risk of liver injury. Luckily, if liver damage occurs from statins, it's usually mild and can often be reversed by discontinuing the medication under the guidance of a healthcare provider. In cases where there's a significant increase in liver enzyme levels, switching to a different statin may be considered. While liver issues with statins are uncommon, as a precaution, healthcare teams might conduct a liver enzyme test before starting the medication or shortly after. Typically, additional testing is not required unless symptoms related to liver problems, such as unusual fatigue, weakness, loss of appetite, upper stomach pain, dark urine, or yellowing of the skin or eyes, become apparent. It's important to stay vigilant and contact your healthcare professional promptly if you notice any of these symptoms. While such symptoms are not common, they require immediate attention to assess and address potential issues. Can supplements cause liver damage? Research indicates that dietary supplements could pose a risk to liver health, contributing to about 20% of liver injury cases in the United States. The ones to be cautious about are bodybuilding supplements with steroids, weight loss aids with green tea, strong vitamins, and herbal products like ginseng and black cohosh. It's important to be careful with these supplements. Before trying something new, especially if it's a strong dose or for a long time, it's a good idea to check with your healthcare professionals to keep your liver safe. Liver problems might start with feeling sick, throwing up, or having strong stomach pain, and in serious cases, it could lead to a coma. Keep an eye out for signs like stomach pain, fever, dark pee, yellow skin or eyes, extreme tiredness, rashes, or pale stools. If any of these show up, head to the doctor right away. If you notice these symptoms, getting medical help quickly is really important. Telling the doctors about any recent medications you've taken helps them figure out the best way to help. It's good to know that others might bring similar risks. Checking the information sheet that comes with your medications and having an open talk with your healthcare providers about any worries is a smart move. In short, being careful about the chance of drug-induced liver problems, even if it's not common, is key. Staying informed, having a chat with healthcare providers, and keeping up with health info helps you make solid choices for your overall well-being. Signs of liver damage. Liver damage might not show obvious signs, especially from certain medications. It often stays hidden until blood tests like LFTs reveal it. But if your liver does show issues, watch out for things like belly pain, swelling, dark pee, feeling sick, throwing up, weight loss for no reason, or yellow skin and eyes. If you're on medications with potential liver risks and notice signs of trouble lasting over a day, reach out to your healthcare team ASAP. They'll likely check your blood with LFTs and figure out if stopping the medications is needed. And if you're unsure about the risks of medication, your pharmacist can help clear things up. We appreciate your support, and don't forget to check out this video. If you like this video and want more informative content, hit the like and subscribe button below. Feel free to drop a comment if you have any questions or insights to share.